Good morning, everyone. My name is Carol Griffith. I'm a reasonable accommodation specialist with MRP, and we also cover FAS. I was a registered nurse for 20 years, and I'm also a cancer survivor. So, cancer, it's a dreaded word. It brings up so many negative images, fears of dying, being disfigured, a long-term illness, and financial distress. Even now, there's a stigma attached to having cancer. Some people may still believe it can be caught from someone else who has it, or that lifestyle choices always had something to do with causing the cancer. But really, what is cancer? Cancer can be defined as any one of a large number of diseases in which abnormal cells divide uncontrollably and infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout the body by the bloodstream or the lymph system. Once cancer cells reach another part of the body, they can grow and ultimately replace normal tissue. Even though cancer is the second leading cause of death in the United States, survival rates are improving for many kinds of cancer, thanks to improvements in cancer screening and cancer treatment. Today, about 14 million Americans are living with a history of cancer. More than 2/3 of cancer survivors in the U.S. live 5 years or more beyond diagnosis, up significantly from years past. Cancer isn't the death sentence it used to be, and many of our employees will be working while in treatment for cancer. Is cancer a disability? Under the Americans with Disability Act, cancer will almost always result in a determination of disability because it will almost always be found to substantially limit the major life activity of normal cell growth and probably others. There are several different kinds of treatment of cancer with different objectives. A primary treatment attempts to completely remove the cancer from the body or kill the cancer cells. The most common primary treatment is surgery, but radiation therapy or chemotherapy may also be a primary treatment. Adjunct treatment has the goal of killing any cancer cells that may remain after primary treatment in order to reduce the chance that the cancer will recur. An adjunct treatment may be chemotherapy, radiation therapy, or hormone therapy. Let's look at those treatments individually and discuss how to accommodate an employee who is working while receiving each kind of treatment. I'm not going to give a complete list of possible accommodations, both in the interest of time and because you will want to individualize the accommodations to fit the situation and the employee. As always, a great resource for possible accommodations is the Job Accommodation Network at askjan.org. But remember, all employees who are working while in cancer treatment, regardless of type, will be suffering from increased levels of stress and quite possibly depression. The employee may require frequent breaks or be allowed to make calls for support during the day. Please offer the services of the Employee Assistance Program too, if that's appropriate. One treatment is surgery to remove a cancer. Much of the problem of accommodating an employee who has had cancer surgery will depend on where the cancer is and how extensive it is. Of course, the employee will require leave, accrued or donated, or possibly FMLA, to recover adequately to be able to return to work. The employee may need a lifting restriction, telework, or light duty, depending on their position and where on the body the cancer surgery took place. For example, an employee who had part of a lung removed for cancer may need a workplace with increased ventilation so they can breathe easier. Another treatment is radiation therapy. Radiation therapy uses high-powered energy beams to kill cancer cells. Radiation treatment can be given externally from outside the body, or it can be placed inside the body. Often radiation therapy given by machine requires daily treatment, and the employee may need leave as an accommodation. An employee with implanted radiation may also need leave as an accommodation too, as sometimes they are not allowed to be in close proximity to other people for a period of time. As with surgery, the part of the body being irradiated will determine the additional accommodations needed. For example, irradiation to the brain may cause side effects that would prohibit an employee from working while in treatment, but radiation to the breast may cause few or no side effects. A third treatment is stem cell or bone marrow transplant. Bone marrow is the material inside your bones that makes blood cells from blood stem cells. A stem cell transplant can use the patient's own stem cells or stem cells from a donor. Very few, if any, employees will be able to work immediately after a bone marrow transplant. They must be hospitalized for a long period of time, and even when released from the hospital, their immune system is totally suppressed, so they will need to be isolated from others for a long time. There can also be some temporarily debilitating side effects due to the medications needed. Another treatment of cancer is chemotherapy. The goal of chemotherapy is to interrupt cell reproduction of the abnormal cancer cells that are dividing so rapidly. Unfortunately, the chemotherapy drugs aren't able to differentiate and kill not just the cancer cells, so they destroy normal cells too. We've all seen people who have lost their hair while in chemotherapy. That's the best and most visible example of how normal cells are destroyed too. Chemotherapy can have many debilitating side effects. The range of side effects depend on the particular drug given and the dosage given. Some employees will not be able to work at all during chemotherapy or even afterwards for a period of time. Others may sail through chemotherapy and be able to work normally. Again, it depends on the type of chemotherapy drug given and the type of job the employee has. Some side effects common to most chemotherapy drugs are severe weakness and fatigue and severe nausea and loss of appetite. Very few employees will be able to work a full schedule if they are experiencing these side effects. A possible accommodation, depending on the type of work the employee does, is to allow them to telework as able. The employee may have times of day in which they feel better and may be able to work for a few hours, even if it's in the middle of the night. So that's a possible accommodation, as unusual as it is. If the employee is able to come to the workplace, a flexible schedule and flexible use of leave may help him or her work. Immune suppression is another severe side effect common to many chemotherapy drugs. Similar to the employee having a stem cell or bone marrow transplant, some employees in chemotherapy have total or almost total immune system suppression, so they will need to be isolated from others for a long period, and so obviously not able to go to the workplace, but may be able to telework again if that's an option. If the employee is able to go to the workplace, an accommodation might be educating other employees about the importance of hand washing and of staying home when ill. Let's talk about the less severe side effects of chemotherapy that are more easily accommodated. There are nerve damage and chemo brain. Certain chemotherapy drugs affect the nerves, again, because they're killing the normal cells as well as the cancer cells. Some people will have problems with balance, and they have loss of sensation and mobility of their fingers and toes. These side effects may last long after the treatment is completed, or unfortunately may even be permanent. The employee with a tactile loss, in which sensation and movement of the fingers are affected, may have a hard time using a keyboard and may need voice recognition software or another assistive technology. Other employees may need to have their non-essential tasks modified to reduce the need for manual dexterity. A loss of balance can be accommodated just as for another employee with a mobility impairment, with a scooter, or a use of a chair for employees whose job involves periods of standing, or any other modification of the workplace. Chemo brain is a common term used by cancer survivors to describe thinking and memory problems that can occur after cancer treatment. An employee may also call it chemo fog, or more formally, chemotherapy-related cognitive impairment. Sometimes it can be a very temporary condition, or other employees may experience it permanently. Chemo brain can be accommodated like other cognitive impairments. Accommodations can include providing written instructions or an electronic organizer, helping the employee set priorities, a self-paced workload as much as possible, and eliminating distractions in the workplace. I love this slide. Let's look forward to some exciting new therapies for cancer that might make a huge difference in the lives of so many people. New research into cancer is exploring immunotherapy, also known as biological therapy. Immunotherapy uses the body's immune system to fight cancer. Cancer can survive and grow unchecked because the immune system doesn't recognize it as an intruder. But immunotherapy can help the immune system see the cancer and attack it. Research is also exploring targeted drug therapy, which focuses on finding the specific abnormalities within cancer cells that allow them to survive. Maybe we'll soon see the day that we don't have to accommodate employees with cancer, that getting cancer will be no worse than getting a cold. Thank you very much.